Okay, so also in the webinar of FSBPT, they discussed the PT test content outline. This is just to give you an idea what you should focus on the most when you are studying for NPTE, and if you really want to pass the NPTE, what are the most important subjects or systems that you have to really master. Okay, so this is the comparison of the 2018 to 2024 content outline. Okay, so as you can see, there is a body system here and there is non-system category. Okay, for the body system, there is cardiovascular, musculoskeletal, and neuromuscular. So as you can see, the total number of questions per system, okay, here, like in the old format, the cardiovascular, 23 to 28 questions. Neuromuscular is the heaviest, 51 to 60, and then the next heaviest is neuromuscular, 44 to 50. Okay, so these are the focus. They should be the focus of your studying the NPTE. Okay, so I'm not telling you to neglect other subjects, but you have to be strong in this system because they have so many questions with regards to this system. So here, the changes, as you can see, not much difference really for cardiovascular and pulmonary. Okay, 22 to 27. They say because of COVID and people with long-standing, condition, pulmonary condition, and it can also affect the heart. Okay, for long-term COVID patient, that's why they didn't really have a major change for the cardiovascular and pulmonary system. Okay, musculoskeletal system, there is a slight decrease here from 51 to 60 questions to 44 to 54 questions. Neuromuscular nervous system from 44 to 50 questions to 39 to 48 questions. Okay, so again, these are the top 3 systems that are heaviest with regards to the questions for NPTE. Okay, so the minor ones are the integumentary system, okay, from 9 to 12 to 8 to 11, followed by metabolic and endocrine system from 5 to 7 to 4 to 6. Okay, gastrointestinal from 3 to 7 through 3 to 6. Okay, not much change there. Genitourinary system from 4 to 7 to 2 to 5. Lymphatic system 3 to 8 to 4 to 7, and system interactions 8 to 12 to 8 to 10. Okay, next, going down for the non-system, okay, the same question for equipment, devices, and technologies 5 to 6. There is a decrease for therapeutic modalities from 6 to 8 to 4 to 6. Okay, safety and protection from 5 to 6 to 5 to 7. The same number of questions for professional responsibilities 4 to 5. Okay, and lastly, research and evidence-based practice 3 to 5, the same thing. So the total number of questions, okay, right now in 2023, okay, and way back then, were 200 questions. From 2024 January, starting 2024 January 2024, it's going to be 180 questions that are scored. Okay, scored questions. Okay, so this is just an overview of the comparison between the old and the new PT content item. Okay, so during the webinar, they also discussed what are the topics for PT and for PTA examinations that were added and what are the topics that were removed. So this will help you as a physical therapist who's going to take the NPTE, so that you would know what not to focus on anymore and what are the new information that you should give attention to. Okay, so for they have this category, knowledge and skill requirements, or they call it KSR. Okay, and there is work activity, so they just have different categories. Okay, for knowledge and skill requirements, they added the impact of regenerative medicine on physical therapy prognosis and interventions related to musculoskeletal system. They added the impact of regenerative medicine on physical therapy prognosis and interventions related to neuromuscular and nervous system, and the provision and utilization of telehealth. Okay, so these are additional questions. Okay, work activities, taping for edema management, electrodiagnostic test results, gross motor development progression, and negative pressure wound therapy. Okay, so what are the items that were removed? Okay, so the items that were removed are phonoapheresis, because there is increasing evidence that it's not being utilized as much as it used to be. Okay, and then taping for lymphatic drainage, and again, phonoapheresis. Okay, so these are the items that were removed, and again, the previous one I mentioned are the items that were added. Okay, so for PTA, the knowledge under knowledge skill requirements, okay, they remove the impact of pharmacology used to treat the gastrointestinal system on physical therapy management, the applications, indications, contraindications, and precautions of phonoapheresis. So these were removed. For one that was added is gross motor development progression. Okay, other topics under work activity that were removed are taping for neuromuscular re-education, taping for pain management, non-selective debridement, application of topical agents, iontophoresis, phonoapheresis, intermittent pneumatic compression, mechanical repositioning for vestibular dysfunction, and participation in professional organizations. Okay, so again, these are the things, the items that if you are a PTA, you should not focus anymore on these items starting 2024, because they no longer will show in the Npte. If you need help with the step-by-step process from start till end to have a limited access to the class and for you to save time and prevent delays, there is a masterclass for that available 24/7 wherever you are in the world. As long as you have internet access, you can access that masterclass. It's called the USPT Turbo Charge. Okay, so that is the masterclass, especially if you have no idea what you're doing, you're stuck and you don't know how to proceed, but you want to really fulfill your American dream. In just one masterclass, it will answer hundreds of your questions. Okay, if you are going to start your US practice, but you have no idea how to document the US style way of documentation, I will walk you through the step-by-step process from PT application. There is a USPT dynamic documentation to progress notes, daily notes, discharge summaries, updated plan of care. That is the USPT Notes Masterclass. So these masterclass are designed for foreign educated physical therapists to improve your confidence and competence. So when you face your first patient, or I don't care how many patients you have faced, but you want to build up your confidence and increase your skill as a therapist, this masterclass is for you. Okay, and also there's a masterclass that I made that is exclusively to improving the skills, the clinical skills, you know, the action in the clinic. How are you going to improve the to decrease the fall risk of your patient in a very effective way that is research backup? You know, the techniques, the strategies that I do with my patient to win the heart of my patient, to improve their function, and ultimately, you know, to give high quality care to our patients. That is USPT golden approach and strategies. And for those who have questions about their visa, the kind of visa that you need to apply here to the US, to work to the US, okay, all questions about visa, again, there is a masterclass for that, and that is the USPT all about the visas. Okay, so check out the link down below. You will find all these master classes, okay, in one page, and you can check them out. The reviews are there. You can see what the actual people experienced through that master classes.